It's our extreme pleasure to have Dr. Bhat with us today. So without further ado, take it away.
Thank you, Vincent. First off, I would like to thank the Simons Foundation and the SPARC study team for this great opportunity to speak to SPARC families and members and give me an opportunity to address formally. So thank you for that. So today's talk will be focused on physical activity and creative movement interventions for individuals with autism spectrum disorder. So this is my outline for today's talk. I'll be talking about why movement is important in individuals with ASD, why movement is important in COVID times. I will discuss the evidence out there for effects of movement and play in people with ASD, and what small changes you could make in your life and your child's life at this time to incorporate movement and play. We will also get to effective strategies to teach motor skills and effects of specifically yoga in children with ASD. This is some work we've been doing over the last few years. We'll go into yoga poses and breaths, and then some final thoughts.
Hey, Dr. Bhat,
Yes.
would you mind trying to stop sharing and then start sharing again? Because it looks like your slides are a bit blurry coming through Zoom.
Oh, okay. So I'll stop and share. And I checked the two boxes at the bottom. And here's the PowerPoint and share. Is this good?
That's weird. It's blurry again. That's odd. Let's see. I don't know how to troubleshoot this on the fly. Let's just keep going. Sorry that they're showing blurry here, guys.
Yeah, they look clear on my end.
Yeah. Okay. Well,
okay.
let's keep going.
Okay. So why is movement important in individuals with ASD? This is because movement is important throughout life. At a very early age, when infants and toddlers are developing their skills, infants who later go on to develop autism actually present with motor delays as the earliest marker of ASD. So this was work I have done with Rebecca Landa and then continued at the University of Connecticut as faculty, where we've reported motor delays within the first year of life. And these delays don't tend to be substantial. They are subtle delays. But what has been reported in the literature is that these delays increase in magnitude and the motor gap increases with development. And this is work done by Kathy Lord in terms of how the motor gap has increased over time in preschoolers. And once children get to school age, so when they're in the school setting, what we notice is that there is this pattern of motor incoordination. So difficulty with fine motor skills, difficulties with gross motor skills, playing on the playground, running, jumping, hopping, playing a sport, engaging in ball skills, catching, throwing, hitting a ball. All of those could be challenging for children with autism. And if it's substantial, that could be diagnosed as developmental coordination disorder. So as the child grows older and becomes an adolescent and an adult, what you might notice is that the individual is not engaging in as much physical activity as is needed, or not engaging it in a social manner, so not engaging in group movement. And what you might notice is that would contribute to perhaps isolation and to some extent depression. And so at all ages, as infants, children, and as adults, it would be important to use movement as therapy for individuals with ASD. So I would like to take the time to talk about some of the findings from the SPARC data set. So we've analyzed the data on the Developmental Coordination Disorder Questionnaire. We have seen about close to 12,000 children. Those are the data we analyzed. And what we find is that majority of the sample, so about 87% of the sample that we analyzed, these are children with ASD between 5 and 15 years, were failing on the DCD questionnaire. So as I said, DCD questionnaire assesses the risk for motor impairment. And what we find is that that risk did not change between 5 and 15 years. So there were many subgroups of children studied, and we still find that the risk continues to remain up until 15 years of age. Also, we find that not all of those children actually receive a diagnosis of DCD. The current DSM-5 allows you to give a co-occurring diagnosis of DCD, and only 15% of this sample actually held a diagnosis of DCD. So what that means is the motor impairment is underdiagnosed to a great extent because motor impairments are not part of the ASD criteria. They are not part of the diagnostic criteria. They are not listed as a specifier. And so the big message of the paper was that we need to consider this as part of the diagnostic criteria, perhaps, or as part of the specifiers, saying that if a child is screened and is at risk for motor impairment, that we identify them as ASD with motor impairment. And why is that important? That's important because access to services are limited if you don't have that diagnosis. So what we noticed in this data set is about 80% of children were receiving speech and OT services, but only 30% or so were receiving physical therapy services. And through OT, you can receive fine motor training, you can receive sensory integration training, but you may not receive as much gross motor training, which might be required for the gross motor difficulties that children have. So why is movement important in COVID times? So I think, we are all being asked to stay indoors or in small spaces. So we are limited in terms of how much we can move. We are being asked to limit our social interactions. So we can't meet our, work colleagues or our friends at school. We also may not have a consistent schedule, and children were used to the structure of having a morning routine, going to school, having their classes and coming back home and then their rest of the day. But now they are at home and their schedule is sort of tied to the schedule of their parent. And so whenever the parent is free, they'll be able to work with their child. There's also an increase in sedentary time. Everybody is working at their computer and doing their homework or doing their studies or work. And so there is more time spent at these devices. In general, there's more stress and anxiety about the infection itself. And there is lack of resources. So, you're not able to go take your child to school and therefore not receive the IDEA services that the school provides, or you do not have the child care to be able to work, while your child needs to be looked at. So you're splitting your time between your spouse and you, or however, to make sure there's somebody caring for your child while you're able to work. And so this is a challenge in COVID times. And I think all of these cannot be addressed through physical activity, but I think at least some of these can be. Especially the unlearning, not having access to services perhaps is leading to some unlearning. And what can you do from your side in a small way or a big way to help your child? Okay. So what is the evidence out there for use of physical activity and structured movement? The evidence, so what is, first of all, structured movement? Structured movement is repeated movement, consistent movement. So it could be treadmill walking or going out for walks or swimming. So repeated exercise goes in this category. And so what is known based on a lit review that we did in the past is that there is definitely improved endurance, so aerobic capacity and muscle strength in children who are receiving prolonged structured treatment. From a behavior standpoint, there is a lot of evidence suggesting that when you engage in structured movement, there is a reduction in motor stereotypies. There's also improved attention and academic focus. So there are basically two types of studies that have been done. One, it's been done in a school setting where the question was, how does this short bout of physical activity impact behavior and academic performance? Or there are these other groups of studies that look at chronic exercise. So you do 10 weeks of exercise, let's say cycling, and what is the effect of that on motor skills or behavior and so on and so forth. And what you find is generally these studies recommend exercise at least 2 to 3 times per week, and these studies go on for 10 to 16 weeks. So these are short-term studies, and what is reported is this level of intensity. So moderate to vigorous physical activity could be done, but your goal is to get breathless as you do the activity. I did not highlight the vigorous physical activity because there is some evidence in the recent years that perhaps the vigorous nature of physical activity could increase stereotypies in the child. So that needs to be studied more. In terms of the time taken, these sessions tend to be 30 to 60 minutes long, but you could do short activity breaks. So if there is a moment you have of 10 minutes that you can go play with your child between their classes or homework or any therapy services they are receiving through Zoom, engage in that with your child. Also, the types of activities are listed here. So it could be any of these. It could be just walks or pacing inside the house. If you have a trampoline inside the house, encourage your child to use that, or ball skills. If you have a soft ball that you can use to play catch with your child, do that. Something that I have noticed that has changed or at least impacted me positively is standing versus sitting. If there is a way for you to encourage more standing or sitting on a more mobile surface like a therapy ball, that might be a little better than just sitting in a static chair. For strengthening, you can use something as simple as water bottles or bean bags in your house. You do not have to have the fancy weights, or just play outdoors or play a sport that your child will play with you. So majority of my work has actually been in looking at creative movement and how these ideas benefit children with autism. And how is this different than, say, structured movement? This is different because here we focus on multiple skills and not just motor skills. So we are focused on nonverbal communication, the back and forth in an interaction with the child. We are focused on motor planning and executive functioning to some extent. We are interested in engaging in fun activities that will promote positive behaviors and positive affect. And we're also interested in promoting motor coordination, balance, and all the skills that I mentioned. So here are two examples. Again, I want to mention that this is work that I started with my student Sudha Srinivasan, who's now a colleague and a faculty at UConn, and we are continuing that work. And so some of these videos are from our current study. But the first the first video that I'm trying to show here is looking at use of instrument play. So how are you going to use percussive instruments to engage in interactions with a child? And this is a call and response game. So the trainer asks, what do you see in a jungle? And the child as well as the adult partner are going to respond.
What do you hear in the jungle? Okay, let's see what Amber has to say.
I can hear the lion roar.
Ooh, that's hard. Look at what she did.
I can hear the lion
roar. Can you practice, Logan?
I can hear the lion roar.
No, look
Okay.
at her again.
I can hear
Can you do I can hear?
the want to practice? Ready? I can hear the lion
roar. I can hear the lion roar.
That's right. Okay.
I can hear the lion roar.
Roar. That's right.
I can hear the lion roar.
That's right.
I'm gonna do it by myself.
Okay.
Okay, you do it.
I can hear the lion roar.
Good job. So I'm going to ask you guys the question 3 times and you guys say, wait, take turns with me. Yeah, look at you. You're such a perfectionist, huh?
Is that perfect?
Yes,
Yes.
it is.
All right. So what you were seeing there were, strategies to interact with children as you're engaging in movement. So you saw the trainer say, look at her. So it might be a brother or a sister or another parent in the room. So making sure they are paying attention to the movements that are being done, or breaking down the activity. That was a good example of that, where they split the sentence into I can hear and then lion and roar. But activities using musical instruments can be used to promote planning and coordination. So here's another example of where we are asking the child to move in space and use their whole body's coordination. Also synchronize, so they're moving and sort of following a leader, following a partner who's moving with them and engaging in balance and coordination skills. This game is called the balloons game. And so here we are focused on use of a creative, fun context of being balloons. And so they will shrink sometimes, they will rise, they will blow in the wind, and so on and so forth.
Okay, get into a really small shape.
Nice and small.
And now I'm going to blow you up like a balloon.
Blow up like
Get
a
into a
balloon.
really big shape. Really big shape.
Nice and big. Good.
And then pop, pop. And get into a new shape. Pop. Nice. Now make your new shape. Good job. Now I'm going to blow you up again. And make a new shape. Good job.
Good.
Make your shape. Making the shape.
That's
Stay
it.
in your shape. Okay. And now you get a leak. Now can you shrink really slow? Into a new shape.
Oh, find your shape.
Make a new one.
Get nice and small on the ground.
Nice. Okay, now I'm putting a patch on your leak.
All right.
Now you're gonna blow up again. And make a new big shape. Alright. And now the wind is spinning you around.
Oh no.
Twirl. Now can you leap? Nice. Keep spinning. And now the wind spins you quicker. Spin quickly. Spin fast.
Spin, Maydon.
Woo! And then you lose your patch, and then you shrink really quickly. Woo! Into a new shape. Good job.
All right, so here what you're noticing is that the trainers are using a lot of waiting and opportunity to move. So, they go into a position and they'll just let the child follow their lead. So you're not telling them exactly do this, but you're letting the free play context allow the child to practice or, choose to move in the ways they want to. And so that kind of free interaction is really important, because when we work with kids with autism, we notice that there is a little spontaneous communication or spontaneous movement. And so we want to provide more opportunities like this to encourage that spontaneous communication.
Okay, give it to a really small.
And this seems to happen. Both videos have to start before I can move on. Okay. All right. So what is the evidence for creative movement? So as I said, most of my work has been in these first three areas. So first is looking at rhythm therapy. So how can you use strategies or activities like singing, instrument play, dancing, and what we found in these studies that are already published is that we see improved child enjoyment. So they smile more, they are more excited to do the activities that we are doing with them. We also see a lot more time spent in synchronous movement, being more in tune with the people around you. And then we also notice in standardized measures, there was an improvement in motor coordination. In terms of the yoga a study that we've done this again over the last few years, and I'll show you some of the data from that. We've used a variety of poses, breaths, and relaxation activities. And what we find is definitely compared to so all of these studies actually compare the intervention to a control group. So these are children who are receiving seated play using academic activities, so reading or art craft activities and such, but using ABA approaches. And what we find is that there is about equal behavior and attention. So they are equally compliant as they would be if they are sitting at a desk and working on skills. They are also showing an improvement in communication. So this is something that we actually found in both, in the rhythm as well as yoga study, that there is an increase in verbal, socially directed verbal communication. And that is more spontaneous in nature. So you see more spontaneous verbal communication over time. And interestingly, for the control group, what we see is high levels of responsive communication. So when you're seated, you have this opportunity for natural back and forth. And so the trainer tends to ask a question and the child responds. Versus when you're moving, there is not a lot of opportunity to speak. So usually what we find is in between the movements, the children would naturally speak and express themselves on their own. Another thing we noticed is improvement in motor performance. We saw improvement in motor coordination and imitation. Again, this is reported in the Kaur and Bhat paper. We actually were surprised we did not see big changes in posture and strength. And we think that is because we did this for over 2 months, and perhaps these skills take longer to change than just a 2-month period. The third area that I have explored is animal-assisted interactions, and the main approach that I have looked at with an OT here locally, Lauren Janus, is the use of hippotherapy. Another thing we've done is we've published a systematic review on equine-assisted therapies, and we've looked at all of these approaches, the hippotherapy and the therapeutic horseback riding approach, and we found that there was a mention of improved behavioral regulation and evidence for improved communication. But in the data that we've collected so far using hippotherapy, we definitely see improvement in behavior. So we see less negative behavior, but we see mixed findings for communication. So a subset of children showed improvement in communication and others did not. But the study is still ongoing, and we're still looking at the entire data set. All right, so the last group here is tech-based exergaming. So this is, something children nowadays like a lot. So Wii, Xbox, or PlayStation, if there are components there that allow them to move and engage in physical play, why not use them? The only issue here is that these can be very addictive to children, and so you want to be sure about allowing a specific amount of time, and this is not the only thing they are doing in terms of interactions and physical activity. Other approaches that are starting to show up in peer-reviewed journals and have some evidence is definitely use of martial arts or outdoor play or dramatic and theatric play. All of these have papers in some popular journals right now and should be considered if you have that access. All right, so here are some simple steps you can take to enhance movement and play right now. So make sure that you capitalize on structure. Children with autism love structure. So if you do this activity every time, first thing in the morning or first thing after you finish work, you are more likely to get compliance and interest in continuing the activity for a long time. So you can take either 1 or 2 longer bouts or few shorter bouts of activity and make it part of their daily routine. Make it creative. You want to sing a song that you like. It does not have to be all the content that we will share with you. So at the end of the lecture, this will be posted and you will have web links in which you can find a variety of songs or a variety of dances or outdoor play activity ideas and also yoga exercises. And so you can use that content, but there is already so much content exploding now online. And also you can simply sing the songs you like or play the song you like and dance with your child. You can also involve pets or involve other children in your house, your other brothers and sisters, and make it a group activity so that the entire family is doing it. And that is what makes the child, even more motivated to do it with you. Play. So again, play, you can involve your child in all sorts of play. It could be outdoors, it could be indoors, it could be seated play. There is seated play that has a lot of positive impact in terms of fine motor skills, cognitive skills, but make sure to give opportunities for creating and playing. There is a lot of value in that based on evidence out there. Again, you want to use approaches that work and that are easy for you, don't become a lot of work. And online videos, there is so much online content which we will share with you, and you will find now that in these times, parents are putting out, experts are putting out that you want to use that to work with your child. So you can use online content as videos, or you can just set up the environment. So if you have a series of props and you go through them, you ask your brother or sister to go through them, then also your child with autism will follow you guys. And also allow time for free play and exploration. Usually what we find is that children are being told to do this or that, and so they are not engaging in as much spontaneous play or spontaneous communication. So you want to allow for time for child-led activities and free exploration. Within a particular activity, you want to be sure to set up this space. And so you want minimal distractions. You don't want a lot of supplies. You want the exact few props you need to complete the activity. Have clear markings to explain the task. You want to make sure there is a chair or blanking a wall or a beam, something to help support if there is a loss of balance. You also could have sensory activities nearby so that if something you're doing is really exciting the child and they are overstimulated, they can calm themselves down. Also use this time as a social check-in because they are probably working on their own or doing their own thing. You needed your quiet time to get work done, and now this is the moment you're meeting. So, have a moment where you're checking in on them, how their day is going, how they are doing. And also follow a session structure. So you want it to be about 20 to 30 minutes or even shorter, depending on your child. And you want to have a beginning and a middle and an ending. And again, you do not have to have these formal picture schedules, but just drawings to explain that there will be 3 or 4 parts so that they know, when you are going to free them. You want to provide a model, you want to provide a demonstration, just say, can you do this? Or use video or pictures so that everybody is seeing it and doing exactly that. And as long as you're doing it with others, so with another parent or with the brother or sister in the house, as long as you're doing it together, they will learn and follow the lead. Make sure to break down the activity, just like you saw in the videos. Wait and give opportunity to move. Waiting is a skill, and children need time to process what you asked of them, and so make sure to wait and give opportunity so for them to figure it out. And then, I do not have to tell you this, but definitely reinforce and affirm. In terms of motor skills, we usually say you want to use the just right challenge, which means 3 out of 4 times that the child does the activity, they should succeed. So you don't want to do something super hard or something super boring and easy. You want to stay somewhere in between. And most importantly, as I said, you want to give child the lead and allow them to come up with activities so you can follow them. So in the what do you hear in the jungle, you could ask the child what they heard, and they can make up their own movement pattern and their own language or sentence and combine those together. Okay, so next we are going to look at some yoga ideas. So we call it creative yoga because we use music and stories and songs to make it fun for the child, as opposed to the typical yoga does not involve creative aspects. And I think this helps provide more context to the poses as opposed to simply doing the poses. But if your child is willing to do that, then obviously you do not have to use all the additional props or stories and such. So here's an example of how we use a song. So this one is the Row, Row, Row Your Boat song. And there is, again, a lot of content online that we have provided as part of the handout, which you will have access to later in the webinar link. But this is just a glimpse of what we used in the study.
Ready to sing?
Row, row, row your boat gently down the stream. Merrily, 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 life is but a dream.
And so what they're practicing is the boat pose, the sort of sitting and lifting your arms and legs off the floor. You can also practice partner poses. 2 children or an adult and a child could practice. And that is great for contact, social contact, and learning to sort of bear your own weight in a socially cooperative task. And then we also use stories a lot. So the story has a few different parts to it, and each part has a particular pose. And when we get to the point in the story where the pose is mentioned, we practice the pose. Other things we've done is used games. So, do something like musical chairs. So have a set of cards or pose names in a bag, and whoever, gets to, when the music stops, whoever gets to pick the card gets to decide the pose you all will be doing. and so on and so forth. So using games, stories, and songs, as well as props to make the activities fun.
Ready to sing?
Okay. So what is the data that we have in terms of effects of creative yoga? So the one of our papers is already published and has reported improvement in coordination on standardized measures, as well as increased imitation accuracy in terms of imitating postures. And we also see improvement in spontaneous verbalization. So the data I have plotted here are the data that we are currently, these data are being reviewed. And what we find is that when you compare children who were in the yoga group to children who were in the academic group and look at their socially directed verbalization, and the one thing I wanted to highlight was the spontaneous verbalization. Here is responsive, which is somebody is asking you a question and you're responding to them, or somebody is saying and you're simply repeating what they are saying. This is not that. This is the child is choosing to speak and say something. And what you see is there is an improvement in spontaneous verbalization in the yoga group. And that final number is slightly greater than that of the academic group, which was the sedentary play using ABA approach. Here is individual data, and what you see is red dots are the yoga group. And by the time the children are in the late sessions, majority of the red dots are higher in that 8 out of 12 children were speaking much more in the late session compared to their early session scores. We also found high levels of compliance. So we see that they are attending to the task more and are not presenting any negative behaviors. What are some of the poses to do in terms of yoga? This was sort of the most comprehensive or most appropriate set of poses. So I used this picture. It includes a series of standing, sitting, and lying poses. And your goal in general for any session would be to practice maybe 3 to 4 poses. And you can go from, say, the standing position to sit to lying, or reverse if you like. The goal should be to learn good posture in each pose because children with autism have a lot of hypertonia, and so they might have laxity in their joints. So, might extend their elbow too much or extend their knee too much, or when you're yourself doing the exercise, you want to be careful about your back and not doing extreme motions in your back. So be careful about how you're doing the poses and make sure to do it the right way. Within each pose, you want to hold the pose for, say, 10 counts and then gradually extend to 30 counts if possible. Counting gives a lot of structure to children, so we use counting a lot. Counting tells them this is how long I'm supposed to do this activity. So use that strategy. And then also find a point of focus. So when you're balancing and it's hard to maintain the pose, like in the tree pose or say the dancer pose, looking at something in space. So if you're doing this in your living room, having an object on the mantle so that they can focus on there helps maintain the pose. You can also breathe in each posture. So 3 to 5 breaths, slow breaths, taking air in and out. You can do this both through the nose, or you could do in through the nose and out through the mouth. And if moving in a pose, you can choose to match your breath to your movement. And so you could breathe in. So the example I give is the cat and cow pose. So you can breathe in when your spine is straight, and you can breathe out when your spine is curled up. And this could be applied across many different postures where you have, two parts to a movement. So if you can't do all of these different poses, we have another solution for you. And so that is called the sun salutation sequence. So children, growing up in India are always told, you need to do your breaths, you need to do your sun salutation. If you can't do all the poses, at least do this. And so this is a mixture of poses or a sequence of movements that are practiced and often done in the morning, by pointing towards the east, the location of the sunrise, and you're going from a mountain pose, which is simply standing, to a waterfall, which is stretching back, a forward bend, a lunge, a downward dog, and so on. So let's look at my son doing the sun salutation. He may have missed some of the components, but again, this is done in many different ways, but that is probably the most common version of the sun salutation sequence. So you can lift your arms up all the way back and do a waterfall. You can do the mountain, you can do the forward bend, then the lunge and do a downward dog, a plank, an upward dog, and then back to a downward dog, a lunge, a bend, and then again you can end with a mountain or end with a waterfall and then mountain. All right, and so doing 5 or 10 of these is a great idea in terms of covering majority of the ranges of motion in your whole body. All right, so next I would like to show you some of the yoga breaths we have done in our studies. Some of these are prop breaths, so you can use a prop to really explain the child how they are supposed to breathe. And we find that children have a really hard time following the right breath ratio. So the correct breath ratio is if you breathe in for a certain amount, let's say a couple seconds, then you want to breathe out for twice the amount of time. And so you have to have a 1:2, ideally you would want to learn a 1:2 ratio in terms of breathing in and out. You can teach them using breaths so that they have a clear understanding of what is happening in terms of movements. And so here's an example of a prop breath.
Breath through your nose and leave out through your mouth.
And so this is a fancy device. You could use your hand. So you could use your hand and place it in front of the child's. So they can use their own hand and place it in front of their mouth, or they can place it on their chest or their belly, or both hands can be on the belly, or both hands can be on the chest. And all of those strategies work for them to understand how breathing feels as they do it. And so here's an example of a sound breath. So using sounds helps the child prolong the exhalation. And this one was focused on inhaling. This one's focused on exhaling. They've already taken their deep breath. All right, and so you can use other props. You can use tissue paper. You can use a mirror so that they can see the mirror fog. You can use a pinwheel. Sometimes these props can be distracting, and so we try to use as much as possible certain props that really work. Also, you can add movements to your breaths. And so what you'll see is you can choose to move your arms up and then move your arms down. And the sort of this bird flying movement helps in increasing the mechanics of your chest movements, your rib cages movements, and increases the air, the amount of air that is taken in or given out. Also, it makes it very clear as to what it is you're doing. You can also move your trunk. So if you're sitting on the floor, in this case, And if you breathe in and stand up to kneel, and then breathe out and curl up your trunk, that also gives you the added sensation you need to clearly take a long breath in and a long breath out.
Breath through your nose.
Okay. And the last set of breaths I wanted to talk about were these nasal breaths, or what are called pranayam. These are definitely harder to do in very young children, but can be done with children, say adolescents to adults. And here what you're doing is your focus is on your breath. You're trying to listen to your breath. You're trying to clear your airways, your respiratory passages as you do this. And again, Ashwin is trying to breathe in through one nostril and then will let go of the air through the other nostril and reverse that. And he is doing a little fast. You want to do it slightly slower, but the pattern is correct in that you're breathing through one and letting out through the other and then reversing the movement. Another pranayam is where you're closing your eyes and closing your ears and really focusing on the breath as it passes through your nasal passages, and you can hear it as you say the om or any vowel sound out loud in your sinuses. And so here's an example of that. He's breathing in through his nose. And breathing out through the mouth. And it does not have to be the om sound. It could be an ah sound, or it could be e or o or oo sound as you exhale, but the focus is on producing the sound and sensing it in your sinuses and passages. Another thing is to remember to, even within this, if your hand is free, you can choose to place your hand on the belly or chest to help the child experience the breath they are taking. Okay, and so some final thoughts. I think movement and intervention is important for individuals with ASD. In this difficult time, we want to stay in the moment and focus on what is within our control, and taking care of our health and physical activity is within our control. So make sure that you are engaging with your child in terms of movement and play. You want to seek advice from experts, because something that I suggest may not work well for your child. So you want to speak to their educator, their therapists at school, perhaps by phone or Zoom, whatever is allowed by your system, to get their input on what might work best to engage your child. You want to intersperse your day with short or long periods of exercise, depending on what your child is able to do. You want to use fun, multi-system play. The goal shouldn't be to just impact movement, but also to impact social communication and cognition, and use appropriate behavioral strategies. What you use when the child works also applies to how you need to engage with your child when they are playing. And yoga is minimalistic. There's not a lot of need for supplies. And so using these poses and breaths might work well for you. It definitely has effects on coordination, and in the literature, effects on strength. We found effects on communication. It encourages positive behavior and attentional focus. And in this day and age, where we are all worried about our respiratory health, it certainly helps in that realm as well. Thank you very much. Actually, the one thing I wanted to show quickly was thank people who are involved in this research. So definitely the families and the students, our several collaborators who are giving us the great ideas for our studies, our funding sources, a listing of online sources. So we have provided a more comprehensive compendium, and that will be posted at the bottom of the talk. But here are just some exemplar resources where information is provided for free. And then our references. And okay, so at this point, thank you so much. And if you have any follow-up questions for me, please feel free to email me. And I'm happy to take any other questions the audience may have.
Okay, thank you so much. We have time for probably a few questions here. We have one that just came in. It says, how is the bot 2 administered to measure the bilateral coordination? My students would not be able to understand.
Yes, so very nice. So what we do is we have, just like you saw in the picture board here. So we have our poses in the form of picture cards. We also have, these are the pictures that are in the manual. We also use the manual itself if needed, but usually we start off by showing the movement. So we say, can you do this? And pretty much show the movement to the child, and then look for their response. If it looks like they are not able to understand, we also show the parts in the book. There are 2 components perhaps of how they are supposed to move. If it looks like that is something hard for them to understand, they're still not doing it, then we provide manual assistance, that is, take them through the movement. But not all children respond to that positively. You know, some of them go limp and actually do not want you to hold their hand. But those are the 3 steps we generally use for each skill. We show the movement to them, either in face-to-face position or in parallel position. So for, I don't know how familiar you are with the bot movements, but for anything ipsilateral, contralateral in coordination, it's easier to explain to the child if you're in parallel to them. And so depending on which movement we are doing, we are either giving a visual demonstration with a short verbal cue and then showing a picture to be more clear. And then if that doesn't work, providing manual assistance.
Okay, it seems like you helped to answer the question. We got a note back about that. Someone is asking if this will be available to view later. Yes, we will post this on our website at sparkforautism.org with the recording, the slides, and the resources that Dr. Bhat showed at the end here of this slide deck. Do we have any other questions? Let me see here, a few more came in. What would you propose for kids that need a bit more support?
And by support, you mean therapy services?
I think in terms of like autism level, so sort of like diagnosis level. So kids that need a lot more support in that realm.
Yes, so actually the group of children we work with range from anywhere from non-verbal to high verbal. So we find that we are able, these activities, the reason why the focus is on engagement is because if you just do squats, or if you just do walking or cycling, it can get boring for a child. And so the focus of the creative movement is to make the activity fun. What we find is that over time, so again, I don't know if I covered that, but the point I want to make is that you want to set up the environment and you all want to do it, and you want to give the child time to follow along. So you don't want to be as controlling when you're teaching the new activity. Because yes, when you're doing anything new, there is going to be resistance. And I'm not showing you the video that I got on the first day. So I did not have the most compliance every session, but there are so many moments where you have that positive interaction and you are able to help the child engage with you and in the activity. But what I'll say is that yes, it is really difficult and challenging to promote motor skills. It's easier to promote, let's say, sitting at a desk and working on tasks, and you want to be patient and you want to give more structure. You want to go back to your basics. You give your structure, give your model, let the child follow your lead, and over time they will do more and more activities that is part of your theme. Yeah, but I see what you're saying, that these are hard activities. It's not easy that everybody will be able to do this. So you will have to find what works for your child and your family.
Okay, I think we'll have time for maybe just one more. Someone is asking about which movements would be best to start with for adults with significant intellectual disabilities.
Which movement? So in terms of activities, I would say structured movement. So it depends on the supplies or resources you have in the house. So those are easy because it's repetitive movement, the same movement over and over. In terms of fun activities, I feel for an adult or adolescent with autism, yoga is a great idea because you don't need a lot of supplies and you can use the simpler poses within this. So if you have certain poses that you think your child can do, you could try those first. Not all of these are simple. I completely understand. I'm not very confident about the arrow pose myself, or for that matter, the birthday candle, but there is a bridge and there is a tree and there is a frog. And so those are the simpler poses are the ones to begin with, and then gradually build on that.
Okay. Let's see, I don't see any other questions in here, so we can wrap things up. Thank you so much for giving this talk. This was really interesting and informative, and hopefully some families can use some of these movements at home since we're all stuck at home these days.